Welcome back to Mass Appeal. Colorectal cancer is the nation's second leading cause of cancer-related deaths in the United States. And during the month of March, the American Cancer Society is trying to raise awareness of the importance of getting screened. And joining us to share more is Dr. Flora Sadri, Chief Medical Officer for the Community Health Center of Franklin County. Thank you for joining us. Now, for all those people out there who aren't 100% sure, what is colorectal cancer and who can get it?
So anybody can get colorectal cancer. Colorectal cancer is a cancer where the cells in the colon start randomly dividing uncontrollably, and eventually this will lead to a malignant tumor or a cancer.
What are some of the signs and symptoms that people might be seeing at home and might prompt them to maybe go see a doctor?
So some of the signs are you may have a change in your bowel habits. So you may be having, not usually to have constipation, but now you have constipation. Or you may have diarrhea, or those two may become intermittent. The other thing that may happen is that you may find some blood in your stool. Some vague symptoms like you may have some bloating, some pain in your belly, anything like that.
But this can all be prevented because we're talking, this is one of the two types of cancers that's actually preventable by screening. Talk a little bit more about that.
Correct. And the other one is cervical cancer, and that we can do with pap smears. So colon cancer can be detected by screening, and the reason why you want to do it is twofold. The first is because you can catch the polyps, which are these growths that can go on to become cancer, and have them removed before they actually become cancer. The other reason is if you have the screenings done, you can actually catch the cancers early in your stage, and that way there you have much better outcomes, and it's much more effective treatment.
When do you recommend people start getting screened?
So unless you're considered high risk, the screening ages are between the ages of 50 and 74, and from there it's every 10 years. If you do have high risk, such as you have a family member who has had colon cancer, inheritable diseases, or that you have an inflammatory bowel disease such as Crohn's, ulcerative colitis, something like that, then you'd want to be tested earlier.
And there's also people who are high risk and who tend not to get screenings as much. Who are they and how can they avoid that?
So the screenings are simple. You know, you can start simply with a fecal occult blood test. The best screening is the colonoscopy because that actually checks out the whole entire colon, and while they're in there, if they see any of these polyps, they can actually snare them, and then they can actually go on to be biopsied and then determine whether they are cancerous or not, and that will then determine your pre-screening for the next time. The high-risk populations that aren't getting screened are some of the Hispanic population, people in rural areas. A lot of people between the ages of 50 and 64 are not getting their first screenings. Then there are some other people like, you know, Native Alaskans or the American Indian population. They're not getting their screenings either.
Well, there's an interesting dichotomy here because it's one of the leading causes of deaths in the United States when it comes to cancer-related deaths, but it's entirely preventable. So it seems to me that it's a problem that people just aren't getting screened.
Right. 1 in 3 people in the United States do not get screened, which is a pretty high number.
Absolutely.
In 2014, in Massachusetts, 2,800 people will be diagnosed with colorectal cancer, and almost 1,000 will die from it.
But it's something that's completely preventable if people start taking the steps and kind of taking charge of their own health today.
Right. It's something that you should talk to your doctor about. You should always be, you know, watching your diet, which is another thing, such as avoiding high-fat diets, you know, what they always say, and eat a lot of fruits and vegetables.
And it's one of those things, I know it gets a bad rap going for a colonoscopy. It's a little bit unpleasant. We were talking earlier, how often do you get to be pampered? Because that's exactly what you are afterwards.
I know, I tell all my patients, find yourself a good book or some good movies on the TV. The prep, yeah, it's a little, you know, bothersome.
But it can help save your life.
It can help you save your life. It's not painful at all, the prep. And the next day you go, they give you this nice stuff, and you don't remember anything, and then you just lay in the bed.
Relax, yeah.
Exactly. And where else can you get crackers and juice in bed?
Not many places. Thank you so much for all these tips. It's a pleasure having you here. It's important that everybody out there gets checked starting at 50.
Starting at 50, unless you're high risk, then you get screened earlier. So everybody, please talk to your doctor. It's a very simple conversation.
If you haven't made the appointment after the show, go make your appointment. Thank you again for joining us, and you can get more information at mymassappeal.com.